So if you want to go ahead and do that, that would be great. And turn your cameras on. So I just text Christy to confirm this, but this is our last quarterly meeting that will only be virtual. So our next quarterly meeting will be the symposium in November where we can be in person. So it would be great to see everyone's faces on camera, and especially for our networking that we'll be doing later. So, and Christy will be doing all the background to make sure that everyone is muted in case anyone gets a phone call or someone comes into your office, because we know that happens. So awesome. So today's an exciting day, but it's also kind of a day of reflection, and I think that's very appropriate for kind of where we are. So as most of you probably know, we are launching the new cancer plan tomorrow. So today we're really going to take an opportunity to hear what the task forces are doing, to hear about what we have done in the past 5 years for our current cancer plan. We're going to talk about health equity. Health equity has always been an emphasis for us, but as we know, 2020 definitely brought health equity back to the forefront for all of us. So we'll talk a little bit about what we are doing there. And then we'll do a little bit of a sneak peek. So we'll do a preview of what you'll hear more about tomorrow with the new cancer plan. So first off, we want to welcome our new vice chair. So Anushay Afghani is joining us as our new vice chair. And she is an oncologist at UC Health. So we're super excited to have an oncologist join our leadership team and also to have someone from UC Health. So she's so far in her first couple of months, she's been fabulous. And so certainly reach out if you don't know Anushay, and I think you will definitely get to know her more in the next few months. So Christy, you want to do a poll? Yeah. So our first poll question of the day, we just want to know, like I mentioned earlier, there's some names I don't recognize here. So have you been to a Cancer Partners meeting before? Do you want to go ahead and launch that? Yeah, thanks, Christy.
Becky's going to launch polls because when she logs in, it makes me not be able to do polls.
Awesome. So, thanks, Becky. Yeah. All right. So if everyone wants to go ahead and answer this, just so we can kind of see where folks are at, see what new faces we have, what veterans we have.
So Allie, you'll have to read the responses too, because I can't see any of that on my end.
Yeah, Becky, can you launch the responses? Awesome. Oh, we have a really good mix. So we have 32% that say this is our first partner meeting, 40% that say they've been to 1 to 3, and 28% that say they have been to 4 or more. So awesome. We'll welcome all of our new folks, and thank you for all of our veterans that continue to hang out with us and be a part of the coalition. All right, I think Christy will, or actually we're doing task force updates. So this next section, for folks that are new, you'll get a chance to hear all of the great work that our task forces are doing. So who is up first, Christy?
We have Lung Cancer Task Force, so Debbie and
Awesome.
Morgan.
Debbie, are you there?
Yeah.
Oh.
I can go, and then Morgan fill in the blanks. Morgan keeps
Sure.
our task force organized. So we're very excited that on November 3rd, the day before the Colorado Cancer Coalition annual symposium, we will be having a pre-symposium on lung cancer screening. And we did have a symposium of sorts last fall. We had our newly formed collaboration of lung cancer screening folks from around the state. We'd hope to have a face-to-face meeting last fall, but it ended up being a webinar, and it was over a series of 8 weeks. It was still quite successful, but this time we really want to do it face-to-face. That's the plan. It'll be a full day on November 3rd at the Sheraton Lakewood. And it is the same location as the Cancer Coalition Symposium, and we will be looking for sponsors. We do hope to make it free of charge. And if we really get enough sponsor money, we might even be able to get CME. So that's still in the works. We have a program committee right now that is working on the program. We're maybe like halfway through. We've got some great ideas and great people lined up to speak. So anybody that might be interested though in volunteering for that program, please let Morgan or me know. And then another bit of good news for lung cancer screening is the U.S. Preventive Services Task Force released revised new criteria in March, and they lowered the starting age to 50 and the minimum pack years to 20. There is research to show that this should address some of the disparities, particularly racial and gender disparities in lung cancer screening eligibility. So we're excited about that. It's going to take the commercial providers several months, maybe a year, to all come on board. I am happy to report that Colorado Medicaid has already come on board with the new criteria. And at the national level, Medicare has reopened its national coverage decision. I am on a committee of folks working on that. We have a meeting with Medicare the first week of August. Optimistic that maybe we'll have Medicare updated coverage by December. But in the meantime, it's kind of a transition period, and lung cancer screening programs are going to just have to reach out individually if they have a patient 52 years old with 20 pack years. And some of the insurance companies are fully on board, some aren't. So it's just going to have to be an individual basis of trying to get the pre-auths. Our next lung cancer task force meeting is August 17th. We will do a deeper dive into the civic report, which we get now every year. We've done it for the past 3 years. And since we don't have currently any BRFIS questions about lung cancer screening, our only ability to get utilization data on lung cancer screening is through that civic report. And it is a very thorough report with information on the utilization of lung cancer screening CT, the shared decision-making, where it's being done, where are the gaps in Colorado, where isn't screening being done, and where do we need to target some of our outreach. So Morgan, you want to add to?
Sure. Thank you, Debbie. The only item I'd like to add with that civic report that I think makes it really unique is that we are analyzing claims data through ICD codes in this instance. And I think that is, I think that's pretty new for any state-run initiative right now, in that we really are looking at data-driven support for any sort of intervention that we would like to launch in the state of Colorado pertaining to lung cancer screening. So I think that's great and something that should be highlighted.
Definitely, thanks.
Awesome. Thanks, Debbie and Morgan. And I see in the chat that Chris Kelly with the Radon program at CDPHE shared that their Radon grants should be sent out by the end of the day on coloradoradon.info. So also a little bit of lung cancer related information. Chris, is there anything else you want to share with that?
No, thank you. I just wanted to make everyone aware of their availability, and it went out by email yesterday to most of our local public health partners, but if you're interested, we do it for nonprofit organizations and other types. So just feel free to go to our website and look. IT is supposed to have it up by the end of the day today.
Awesome.
And then Chris, can you comment on the legislation that passed?
Oh, sure. Actually, this year, there was a bill through the Colorado legislature that will require that radon measurement and mitigation contractors be certified in the state of Colorado. And actually, the requirement is through our Department of Regulatory Agencies that the Anybody conducting radon measurement or mitigation must be licensed by DORA, the Department of Regulatory Agencies. And that licensure is via certification. So they'll either have to be certified by the National Radon Proficiency Program or the National Radon Safety Board in order to get a license with the state of Colorado. And that will become effective July 1st of 2022. So that's a huge change for our state. Thanks, Deborah, for bringing that up.
Yeah, well done.
Yeah, that's really exciting. All right, next up we have HPV. Jenny, you want to give us some updates from your task force?
Sure. Thank you for putting the next meeting on there. Our next meeting is fast approaching. We meet on the first Thursday of every month from 9 to 10. We're still remote. We haven't talked as a task force about returning to any in-person meetings, but one thing that we're still working on developing is an opportunity to plug into the peer sharing webinars and even potentially doing some sort of HPV series, whether that be like an HPV 101, talking about all the other benefits of the HPV vaccine, not just for cervical cancer prevention, but the types of oropharyngeal cancers that it can prevent. And we're looking at highlighting some guest speakers and really championing the work that is going on in the state of Colorado through the Alliance for HPV Free Colorado and the work that they've been doing specifically for the dental community.
Awesome. Thanks, Jenny. Colorectal. Sarah, are you
Yes.
our updater? Awesome.
Yep, I am. Yeah. So I'm for those of you who don't know me, I'm Sarah. I'm the new co-chair since Meg unfortunately left. Off to go back to Montana, I believe. So I'm co-chairing right now the Colorectal Cancer Task Force with Ian. Ian is out on vacation this week, but just a few updates. We have a few work groups. We've got 3 in total. The provider support work group has been working on identifying ways to conduct a needs assessment to figure out what we can do as a coalition to better support clinics or providers to help communicate the new screening guidelines so that we can help enhance screening rates. And then a longer term goal with the provider support work group would be to potentially hold like a statewide statewide colorectal cancer roundtable discussion around what we can do to help support clinics to increase screening rates. The awareness work group, it started out as a March awareness work group, but we figured why not focus on colorectal cancer awareness throughout the year. Some highlights from March were that we were able to do a Spanish radio station interview in Spanish with a Spanish speaking GI provider from Rocky Mountain GI. And we've helped do a social media campaign. And what they're working on now is a pro bono screening day in Fort Collins, trying to sort out what the cost of a donated colonoscopy looks like. And then I know they had success working with Penrose and a local GI office to do 10 free colonoscopies a year. You can go to the next slide. Thanks. And then the other work group that we have is the employer engagement work group. A big highlight for them is that they've finished the employer toolkit. And this is a tool for employers to have access to. And the idea is that it would be something that the coalition or someone from this work group would review with the employers rather than just saying, emailing it and sending it out. This is just a screenshot. It's maybe difficult to see if your screens are small, but this is just a screenshot on the the right hand of the screen of the table of contents, just so you can kind of get a feel for what is covered in the employer, in this employer toolkit. So why should your organization promote cancer screening in the workplace? Starting with that, covering just different cancer screening initiatives, incentivization programs. And then we even provided some example letters and emails as well. So that was a really nice accomplishment from that work group within our task force. And then I don't know that I put it on the side, but our next meeting is the 12th of August. It's a Thursday morning, and CCHN will be presenting on their efforts and ways that we could work together for colorectal cancer screening there.
Awesome. Thanks, Sarah.
Yeah.
Survivorship and palliative care. Janice?
Hi, I think Carlin is on the call as well. So
Okay.
Carlin and I co-facilitate and work with this particular task force. We have primarily been focusing on providing educational opportunities for our membership to learn about any kind of new information that is relevant to survivorship and palliative care. And our next meeting is Tuesday afternoon at 2:45. And we will be having a wonderful speaker on oncology rehab. And what I've learned in terms of my own practice is that oncology rehab is not available or recognized as a specialty in all states. And Colorado is considered one of the premier sites for oncology rehab. So we hope you'll join us for that presentation. We usually have a networking time at the beginning of our meetings, and then we talk about the presentation for the next, 30, 40 minutes and take care of some business as well. And we continue to network with other like-minded organizations to see how we can work together. And we've also facilitated and hosted a recent webinar on young survivorship issues and challenges. And that recording was held on July 14th. And so I think it should be up on our website, on the Coalition website, in terms of webinars right now. Is that right, Christy?
It is not up there yet. It will be up there next week.
Okay, very good. Very good. Thank you for doing that. So we continue to meet every other month at on the fourth Tuesday of the month at 2:45, and have an opportunity for us to network as well as learn more information. So we don't have any other primary initiatives at this point. Does anyone have any questions about that?
Carlin, is there anything you want to add? Yeah, go ahead.
I just would like to thank Janice and the coalition and our 185 task force members. I think there's definite interest in our concept, and we're excited to see how the cancer plan launch goes tomorrow, as that will shape kind of our fall activities. So thank you.
Yes, very good. All right, thank you.
Great. Thanks, Carlin and Janice.
This is going backwards. Sorry.
Christy.
Yes, I'm going to pipe in now, and I always forget to introduce myself. I'm Christy Cahill. I'm the Executive Director of the Colorado Cancer Coalition. So it's so great to see so many people here and so many new faces. So thank you for taking time to join us today. And I'm going to fill in the Skin Cancer Task Force update because they're actually out in Cheyenne Wells, Colorado, helping spread sun safety awareness messaging and other cancer screening info to a big festival that Cheyenne Wells is having this weekend. That's part of our Coalition and Communities campaign, is really going out into those rural and frontier communities and elevating the conversation around cancer prevention, early detection, and sun-safe tactics and just lifestyle behavior change that people can make. So they're not here because of that. But the task force chairs are Ronald Yang and Neil Box. And Neil Box is actually the executive director or the CEO of the Colorado Melanoma Foundation, and they are the ones that run the Sun Bus. So we've been collaborating with them pretty heavily for the past year and a half, trying to get more than just sun safety messaging out there, making sure we take the American Cancer Society screening guideline one pager out that has all the different screenable cancer types, so that while people are milling around waiting for to either see a dermatologist or do the reveal imager, they can learn about other cancer types as well. So hopefully you'll see more of the Sun Bus at future events. me just double check the chat. Becky put the Sunbus link into the chat, and you can go to their event calendar and see where the Sunbus will be. And if you have a big event where you think the Sunbus would be an asset, you can always email Neil and suggest, tell him how many people are going to be there, what your goals are, and you can see if the Sunbus can come to your event. The flyer I was mentioning, Denise, is more about screenable cancers and the screening guidelines. There probably is a flyer for the Sunbus, but I think just sharing that link around the event calendar would be the best way to get the word out about where the Sunbus is. I'll pause now. Any other questions for any of the other task forces or questions so far?
Yeah, if you have questions, feel free to pop them in the chat, or you can come off mute too. That was a lot. I feel like that was like speed updates.
All right, I'm not seeing anything. So I did want to mention that there will be 2 new task forces coming down the pipeline, new and or bringing them back. We will be bringing back the breast cancer task force with a strong focus on genetics and family history. And then we're also going to be starting a clinical trials and treatment task force. So if you are interested in any of those, let me know and I can make sure to get you added to those distribution lists. Becky, will you put my email in the chat box, please? So you can just shoot me an email and let me know that you're interested in those task forces. And then as far as the other task forces, if you're interested in getting plugged into those, they all have their own individual email addresses that you can find on the website, and you can email them to get added to their distribution list. Okay, so that was a lot of info, and what's coming next is also going to be a lot of information. I wanted to share with everyone, what the coalition has been doing for the past 5 years related to the 2016 to 2020 cancer plan. So there's a lot of information. I'm going to go through it quickly because I want to leave most of the time at the end for partner updates and speed networking so we can go into breakout rooms. So if you have a question, put it in the chat. Feel free to pipe in and interrupt me. But I'm going to show you a sampling of the work that's been done over the past 5 years to help eliminate the burden of cancer in Colorado. And all of you have had a hand in that, if you know it or not. So this isn't all stuff that just the coalition did. I'm going to be sharing partner updates of new programs that partners started that align directly with the Colorado Cancer Plan. We'll be sharing the state health department's priorities and how those align. So it's a lot of information. Feel free to stop me if you have a question, but I am going to go through it quickly so we can get to the fun stuff at the end. So before we jump into this, I wanted to know people's familiarity with the cancer plan. So Becky, can you please launch poll 2?
So for poll 2, we have, I've never seen the cancer plan. I've seen the cancer plan, but never used it, or I've used the cancer plan in my work.
And if you don't like any of those options, feel free to chat different response into the chat.
Yeah. And if you've never heard of the cancer plan, please join us tomorrow where we will be launching the new one, and you will get to learn all about our new goals and strategies for reducing the burden of cancer in Colorado.
There's 3 people who haven't voted. You want to wait for them, or should we launch it?
I think we
Two left?
can launch it. That's fine.
All right.
Oh, we also have a good mix of this. So 30% said they've never seen the cancer plan. 33% I've seen the cancer plan but never used it. And 37% said I've used the cancer plan in my work. So Chrissy, do you want to do just a little overview of the cancer plan for a third of the group that is unfamiliar?
Sure. So Every state has a cancer plan. We are on, I guess we've had one now for 25 years. And so we are about to launch the 2021 to 2025 cancer plan. And we really use it as a roadmap to helping prioritize our work in the state. And it's gone through iterations of being siloed by body part, so like lung cancer, breast cancer, pediatric cancer. And in our current iteration, it looks a lot like it did for the past 5 years, because we're trying to track the progress over time more easily. And so it's now set along the continuum of care. So it starts with prevention chapters, and then moves on to screening and early detection. Then it has treatment, and clinical trials, and then it moves on to survivorship, palliative care, end of life, and then it ends with some cross-cutting goals around health navigation and health literacy. And it's a guide. Some people use it to write grants and say, you know, Colorado has prioritized this. This is what we're going to work on. The task forces use it to guide their action plans. Researchers at the university use it to apply for grants. There's really many ways it can be used. And it should be, you know, it's created by subject matter experts from across the state. A huge thank you to Becky Seelig for handling the rewrite process and convening the committee to do it. It will be launching tomorrow because of all the hard work she has done. So thank you, Becky, for all that behind the scenes work. Any other kind of Janice, yes.
Yes, so I'm curious, I may have missed it as you were listing how the new cancer plan is laid out. Is one of the cross-country or cross-cutting topics diversity, equity, and inclusion around cancer care?
It is peppered in throughout some of the different goals and strategies. So it's specifically called out in some strategies to work with priority populations, or increase diversity in clinical trials. It's peppered in throughout. We did just learn of another state who created their cancer plan. Becky, do you want to pipe in on how that state did it? And you know more than I do.
I don't have many details, but rather than across the continuum of care, which is how the Colorado plan is currently laid out, they've laid theirs out across social determinants of health. So it's really a new kind of different approach. So it'll be interesting to see how it goes, because I think it's the first time, you know, we're really thinking about cancer care in that way. So,
Becky, do you want to explain a little bit what social determinants of health means, just in case someone doesn't know?
On the spot. So it's all the other factors that play into health outcomes, such as housing, access to food, health. So it's the periphery components of our lives that contribute to our health outcomes. Where you live, you know, if you have access to healthy water or clean water, education, so forth, which all plays a role in ultimately how healthy we are able to live. Mm-hmm. So it'll be interesting to see, Janice, how that state lays it out. They hadn't finished it when I heard about it, so I'll be curious to see what it looks like. Our plan still is across the continuum of care, but as Christy mentioned, the evidence-based strategies that are recommended do include a lot of strategies that get to the health equity aspects of what we're trying to do. And I do not remember which state it is that is laying it out that way, Cheryl, but I will find out and see if they've released it yet, because it'll be interesting to see what it looks like.
Was it Utah, Becky?
I will have to do some digging.
Okay.
All right, thank you.
Yeah, there's a resource online where you can see every state's cancer plan. So if you're interested, we can send that. I can add that link to the agenda.
Yeah, and I'll just add, I think a lot of other states are kind of on the same timeline that we are. So there'll be a lot of new cancer plans coming out. I know that Idaho just released theirs last week too. So it'll be exciting to see everyone's kind of new version.
And are there opportunities for mid-course sort of correction or revisions? Is that part of the review process and evaluation about how well it's working in our state?
That's an excellent question. And, with this version, there will be a PDF at the beginning, but this is going to be a living document. A lot of it I plan to update on different on web pages, so it can be dynamic, and it can change as priorities change, so that it's not just a PDF that sits on a shelf and is outdated as soon as you print it. So to your earlier question, we can add we can highlight specific health equity resources related to different goals. I know ACS has some health equity resources that I've already linked in there. The Comprehensive Cancer Control National Partnership has an extensive list of resources that we can refer to. So yes, the answer is it's a continuing improving process. And we'll share lots of different resources that task forces can use and members can use, so that we're really prioritizing, the populations in the state that need help the most in terms of improving outcomes and earlier detection and all of that.
Very good, thank you.
We do have a question in the chat from Morgan. Becky or Christy, what are the advantages and disadvantages to using social determinants of health to develop the cancer plan? Or is that still unknown? We'll find out since it's the first time that it's been done.
Probably a little bit of both, but I think it's getting at really understanding the complexities that are involved in reducing disparities, and understanding that in order to really reduce disparities and increase health equity, we really need to start figuring out how to address the social determinants of health when we're looking at the full picture of cancer care. So I think it's understanding the connection between all those pieces. So I think it's going to be interesting to see if that changes the way that they approach their work. But I do think that understanding the social determinants is going to be really the new direction that we're going to have to start focusing a little bit more on. That's my opinion. If anyone wants to add anything to that. And I don't know if that answers your question, Morgan.
Yeah, 100%. I think that is the direction we're heading in. I'm just thinking about, for instance, if you're looking at, not just the direct disease, but you're looking at, the food people are eating, the housing they have, the water they're drinking, the air they're breathing. Those are all definitely important factors. And those, I think, we can now, they can explain why some people do get cancer, because of their environment and these carcinogens. I guess my concern would be is that with a shift like that, are folks who are used to the more traditional model of focusing on specific cancers, are those folks going to feel eclipsed or occluded? Is there if you're focusing on housing in general and how that dumps into a bunch of different types of cancers, are folks for a particular cancer going to feel left out? How do we manage that transition, if you will?
Yeah, I think that's an excellent question. Even when it comes to task forces, like which task forces do you have, which ones do you not? And so it's ever changing, based on priorities within Colorado, based on who's at the table at the moment and willing to lead a task force. And so that's why I think, all the social determinants of health are currently peppered in to the first 4 chapters. And it's just not called out across the entire cancer plan that way. So I think it's just, finding the right partners to bring to the table to, like Chris Kelly was speaking about radon. She really kind of heads up that work in the state, and she's been a great partner on the lung cancer task force. So we need to find somebody like that in for some of the other environmental ones. We don't have strong partnerships there right now. So as this new plan launches, we'll be really intentionally reaching out to new partners to see who can help fill some gaps along some of the social determinants of health and other priority areas. So I'm gonna keep us moving forward. If you have something else, pop it into the chat. And then I just wanted to say, none of this is possible without all of you at the table. So I really appreciate that you take the time to come to these partner meetings, attend task force meetings, help implement the cancer plan. You'll see in a little bit at the end about how much money we have to implement the cancer plan, and you'll see why you're so important to be at the table to help really implement the plan. So thank you for being here and engaging with this work. So before I go into every year from 2016 on, I do want to turn it over to Becky to talk just a little bit about the Colorado Department of Public Health and Environment and how, like what work they've been doing in the cancer arena, which aligns with the Colorado Cancer Plan. So Becky, I'm going to turn it over to you.
Thank you. I just wanted to give a quick overview of the priorities at the health department. We work very closely with the coalition and a lot of the work that we do. These are some of the current priorities. We are undergoing strategic planning right now as we will be applying for new funding through the CDC that will start in 2022. So I imagine most of these will remain, but there may be a little bit of a shift in some of our key priorities. But currently, we are working to increase HPV vaccinations, decrease obesity, increase some safety behaviors, decrease radon, increase screening across the screenable cancers, increase quality of life for cancer survivors, and then, of course, capacity building for coalitions. So like I said, work very closely with Christy and the coalition to be able to help us achieve a lot of our goals and priorities. So next slide. So this is really just a pretty graphic that I believe Shannon, our cancer evaluator, created at the health department that kind of gives a different snapshot of the work that we're doing at CDPHE. So this is a snapshot of the interventions and activities that we currently support or fund at the health department. You'll see across the bottom, that's the continuum of care. So you'll see where they fit across the continuum. And then kind of from the bottom to the top, that is the socio-ecological model. So you'll see individual, interpersonal, organizational, community, and policy. So you'll see kind of what some of the strategies and interventions are and where they fall within both the continuum and the model. Just a quick snapshot. Happy to answer more questions about any of these, but just gives you an idea of what we're doing at the health department. So thanks.
Thank you, Becky. And yeah, the health department has been instrumental in being a partner in providing resources in kind and providing grant dollars for cancer plan implementation, and just overall being a good partner to help get this work done.
And I'll just add one thing, Christy, to that, kind of to, I think, Janice's question too earlier. If you just go back, you'll see the overarching health equity and partnerships is really kind of the key component to the work that we're doing. So we embed strategies that get at health equity across all of those, and really the partnerships are where we do most of our work. So thank you to everybody who works with us for this important work. Okay, back to you.
Great, thank you. Let me just get my screen set up. Okay, so I just want to reiterate again, this is a sampling of work that's been done. I'm definitely missing really amazing, innovative programs that have happened. But I just wanted to showcase, how you can implement the Colorado Cancer Plan, how you can help implement it. So in 2016, this was a rebuilding phase for the coalition. We launched the 2016 to 2020 plan, and we restructured the coalition, went back to a model where we have a fiscal agent and we have our 501c3 through the fiscal agent. And at that time, CDPHE provided staff time in kind to help keep the coalition moving forward. And when we relaunched the cancer plan, we had all of the body body part specific task forces like lung, breast, colorectal, but we also prioritized at that time financial barriers, patient navigation, and family history. And so those task forces started. And then once the plan was launched, the 10 task forces at the time created 2-year action plans and then got set to work implementing the cancer plan. So that's 2016, very quick and dirty. 2017, here's just a few of the things that happened. You know, collaboration is huge. We're all better together. So we started a partnership with 9 News for Buddy Check 9. And monthly we would post different cancer screening information, risk factors, and occasionally we would do call-ins, so people could call in. We would find experts to man the phone lines, and you could call in and ask your questions about colorectal cancer or breast cancer or family history type things. And so that was a pretty neat media partnership. The Colorectal Cancer Task Force worked on the 80% by 2018 campaign. Ovarian looked at trying to work with COPIC. And if you don't know, COPIC provides the malpractice insurance. The Family History Task Force worked really heavily with the Colorado Cancer Genetics Alliance to get a new website up and going all around family history and how to find a genetic counselor. The Colorectal Cancer Task Force also worked with the Colorado Business Group on Health. The Patient Navigation Task Force collaborated with the Alliance. And the Colorectal Cancer Task Force also collaborated with the Colorectal Cancer Screening Program. And we started doing, so after the cancer plan launch in 2016, we started doing an annual symposium. So we had our first symposium for our redo. So how these align with the cancer plan. So with the Buddy Check 9, we had a month on skin cancer, so decreasing exposure to UV radiation. We had the Reveal Imager on screen with media, and they like looked at someone's face so they could see the sun damage and show that to all the viewers. For the family history angle, you know, 3.1 is to increase collection. That looks like a typo. Increase collection of family history to ensure appropriate and risk-based cancer prevention messaging. And so these are all the new goals. So you're getting a sneak peek of the new goals. The colorectal worked on implementing workplace policies to support individuals to complete recommended cancer screening. And then a lot of the work we do aligns with 5.1 and 5.2, which is around increasing cancer screening rates all across Colorado, and especially in some priority populations. So I'm going to go a little bit into detail about the task forces so you can see what types of things the task forces work on. So I mentioned some of these previously, but they also do they've been rock solid in hosting a really amazing March Colorectal Cancer Awareness Month, where they always get a governor's proclamation. They've had a vigil down at the city and state building. And again, they had that they had a presentation to the Colorado Business Group on Health, as well as the Cancer Caucus, which those helped educate lawmakers, which is one of the strategies, implementing the workplace policies, like I mentioned. Moving on to other task forces, the Survivorship and Palliative Care Task Force hosted a really amazing Survivor Day with laughter, yoga, cooking demonstrations from Project Angel Heart, just really cool programming to help improve the physical well-being among cancer survivors and caregivers, as well as the mental well-being, just having that space to connect. And then again, this is just shows you when you use that Reveal Imager with skin cancer, the Skin Cancer Task Force, you can see that sun damage and hopefully affect a little bit of behavior change for somebody going forward and having more sun-safe habits. So here is a partner update. So not just a specific task force update, but the Colorectal Cancer Screening Program rebranded to become the Colorado Cancer Screening Program, and they added lung and family history as priorities. And they also focus on navigation and reducing barriers. So again, like I mentioned, the coalition can't do do this in a silo. So we really heavily work with partners to implement goals from the cancer plan. So this partnership gets at many different strategies, but specifically it gets at 5.1 strategy 12 and 5.2 strategy 2, which is around making sure navigators are in the community, able to get people in for screenings, and really shows the importance of navigation to increase those screening rates. So many hands make light work. So here's another example of partnerships. So CDPHE has the Cancer, Cardiovascular, and Pulmonary Disease Grants Program, and cancer is carved out in that as a priority area. And their priorities ebb and flow through the years, but they've had radon, HPV vaccination, cancer screening, some survivorship in the past. So this is just a listing. I highlighted or I bolded some of the topics for you there so you could see. But again, this is other work going on in the state that aligns with the cancer plan. I'll stop here and see if anybody has any questions.
2017 was an exciting year. That's a lot of stuff. Good work, everyone.
Okay. All right. Well, we will keep going then. Okay. So 2018 highlights. Again, highlighting collaborations. We started really working closely with the Colorado Cancer Caucus and trying to host joint partner meetings so that we could have you all at the table as well as legislators at the table. We hosted the Biden Cancer Summit with the cancer support community, the Cancer Caucus. I feel like there was another partner, but I can't remember who that was at the moment. So if that was you, I apologize for leaving you out. We continued Buddy Check 9. We started the HPV task force, worked heavily with the HPV Free Alliance. And then we again had discussions with COPIC. And so the theme here and throughout the entire plan, you'll see a lot is provider education. And that's primary care providers as well as specialty care clinicians as well, and really just being partners with them and helping them get the information they need so they can make sure cancer prevention is top of mind and cancer support. Let's see. Okay, moving on. Oh, again, we had our symposium. Some task force highlights. So the Family History Task Force hosted a primary care provider workshop to talk all about family history and how they can, get accurate family history from their patients and where they should refer them. The HPV Vaccination Task Force hosted 6 different Someone You Love screenings. And this was a really cool partnership. CDPHE, the Women's Wellness Connection, purchased the license for the Someone You Love screening. And then the coalition gave the HPV task force funding to go out into the community and do motivational interviewing. And Denver Public Health helped with motivational interviewing. So it just is a really good example of different partners bringing either funds or expertise to the table to really make a greater impact. So we would go out into the community, have the screening, have Q&A after the movie, and then the next day or the day before, the motivational interviewing would happen with some providers from that part of the state. And then the HPV task force also started working with more oral health providers. So again, just highlighting what those goals are. So a few more task force updates from 2018. The Patient Navigation Task Force started working with the Academy of Oncology Nurse Navigators. We created a Facebook group so navigators could share de-identified information, asking for resources and things like that to find resources they might not know about for their patients. The Alliance of Promotoras, Community Health Workers, Patient Navigators, we started to be an affinity group, a cancer affinity group there. And then I would say the biggest success was the Navigator Night Outs. Those were sold out instantly when we would put, and they were free, but they were sold out instantly when we would put registration up. And that was a time to provide education as well as a time for navigators to network and get to know each other. The Lung Cancer Task Force began getting the all-payer claims data that we mentioned earlier. And then the Survivorship and Palliative Care Task Force did a Cancer Fund grant and created a brochure around palliative care, and got that distributed to various places all around Colorado. There's a few comments in here about the Someone You Love. And yes, sorry for not mentioning that. It's a documentary that follows the lives of 5 cervical cancer patients and survivors. And it's definitely a tearjerker. But it is a really good conversation starter. So the Skin Cancer Task Force, one of their biggest priorities has been going out into the community to spread sun-safe messaging. So they utilize a lot of med students and volunteers to go out and use that reveal imager and show that sun damage. Deborah Hess is single-handedly responsible for doing those 800 plus people on the Western Slope. So she's got a camera out there, and she's been a great long-term coalition volunteer, really on the Western Slope across all cancer types. But she's been great with the imager there and getting people to come to events and do the camera. So Colorectal Cancer Task Force, they hosted these are the things you remember, a very snowy 80 by 2018 call to action breakfast, because when it starts snowing, you're like, there goes the attendance. But they still had a really good showing there. And that was a provider education opportunity. The coalition worked with the Colorado Cancer Screening Program to do a text messaging campaign. It was a really cool, automated and very tailored text messaging campaign to help increase cancer screening rates in Southwest Colorado for colorectal, breast, and cervical. So once you gave your phone number, you'd start being asked questions like your age, when have you had a colonoscopy, when was your last one, and it would spit out different responses based on your answer. And then ultimately it would give you the number of a navigator to call to then schedule your colonoscopy and breast and cervical screenings. Again, they did their March Awareness Month, and then more presentations to the Colorado, or the Business Group on Health. So, and then I wanted to highlight another partner program. The grants had typically from the health department had focused on breast and cervical, and then there was a small chunk on colorectal. And in 2018, they renamed and kind of combined 2 grant programs to be the Cancer Prevention and Early Detection Program. And so now it focuses, some of the strategies focus on breast, cervical, and colorectal versus siloing them like they have been. And then another exciting partner highlight, the Colorado Ovarian Cancer Alliance launched Carol's Wish. And here you can see a little snippet of what the new cancer plan is going to look like. But this program that helps provide financial navigation for gynecological patients directly aligns with the cancer plan and helping reduce financial barriers for patients. So again, having these partners at the table is huge and helping really move the needle in cancer work in Colorado. Here's the CCPD grantees. Just checking time. Okay. 2019, again, collaborations. We hosted a collaborative partner meeting with the Cancer Prevention and Early Detection Program and the Colorado Cancer Screening Program. We had our symposium again. We started working with Channel 7 instead of Channel 9 on a cancer series. Throughout the years, we've worked with different different hospital systems on their survivor days. And so we've worked with the university's Cancer Wellness Conference. And then we also became a Catalyst grantee for some colorectal work, which I'll go into. So HPV, they got a mini grant to attend different trainings, as well as send some informational packets to different clinics around the state. And so this aligns directly to 3.2, which is really increasing uptake of HPV vaccination. Colorectal hosted a lot of different educational opportunities and started all their different work groups. So they had that a provider education work group, the awareness work group, and the policy work group. And the Catalyst grant that I mentioned, that gave us funding to hire a lobbyist and try to work to get, this was before USPSTF changed it, try to work to get the screening age lowered to 45. Lung began their work in 2019 around creating the Colorado statewide collaborative on lung cancer screening. So they did a survey to assess needs. They also worked with Rocky Mountain Public Health Training Center to update some lung cancer screening and shared decision-making videos, and then continued conversations with COPIC. Survivorship partnered with 4 different organizations on their Cancer Survivor Day. And then here's a smattering of the educational opportunities that they provided to task force members and the coalition at large. So a lot of the task forces bring in guest speakers for their different task force meetings to help provide that educational piece and connection to resources that you might not know are out there in Colorado. Okay, I'll pause here. Any questions? And if you've been involved and completely left something out huge that you really want to mention, please feel free to pipe in. I was just going from memory and past year in reviews, and
you're doing a great job, Chrissy. Thank you. That's a lot. I don't think all of us really appreciate all of what's going on. We tend to have our nose down in our own work and sometimes miss the bigger picture. So thank you.
Yeah.
And I'll just add to that. It's great to see how everything really does connect back to the cancer plan, that, we really are doing things that are making a difference and reducing the burden of cancer. So
now I know why we are all so tired.
Right.
All right, so moving to 2020. We had lots of intentions for 2020, but we all know where that went. But I think we were really able to do a lot, and I'm really proud of all the task forces and the leadership team for being innovative and powering through and really still getting some quality programming out into the community. So we started off in January by going out to Colorado Springs, and we hosted our partner meeting out there with, again, with CPED and CCSP. It was a great collaboration. We had a lot of new navigators at the table. Since we were in Colorado Springs, we were able to bring new faces to the table from that part of the state. We also did it on Zoom, so people in the metro area could participate as well. We did a World Cancer Day campaign on social media. We were already used to Zoom, in an effort to be statewide. We've been offering Zoom for the past few years for task force meetings so that you can join from anywhere in Colorado. So that was an easy switch to just go all virtual. Thank you to Becky again. We did I don't even remember actually what it was, but we did our virtual symposium. And I guess it was 2 days. It was still 2 days. Was it right, Becky? Yeah, still 2 days. And Debbie Dyer mentioned earlier the lung cancer screening series, which ended up being a nationwide endeavor. And again, a very cool collaboration of different partners coming to the table. National Jewish helped with the CMEs. The American College of Radiology helped with registration and outreach, which made it a national event. ACS was at the table. Sorry if I'm forgetting anybody else. But again, we all put different resources, both some monetary, some expertise type, and really made that hugely successful. We, at the very beginning of the pandemic, we very quickly hosted some webinars around COVID-19 and cancer patients and put new resources up on the website for cancer patients, as well as we took the great resource that Janice had started on cancer support groups. And it had historically been a PDF that Janice would send around monthly that is an amazing resource of almost all of the different cancer support groups in the metro area. And we turned it into a Google sheet that her former colleague at SCL Health updates in real time. And when she updates it there, it updates it on our website. And so people can see the latest cancer support groups happening right now. And it's sorted by cancer type at the bottom. So you can either see them all listed or you can search for the specific cancer type you're looking for. So if you ever get a question for somebody looking for a support group, that's where you can send them, and hopefully they'll be able to find one that works for them. And Becky is putting these links into the chat. The last thing we did have a bill that we were trying to run around colorectal cancer and lowering the age, and it went through the House, and then the session paused because of COVID, and then it got totally just got killed when we came back because it was not priority. So we got to learn a lot about policy work in those 3 months leading up to COVID. Some other intentions we had that didn't really get to play out. We had hoped, so since we had started with Colorado Springs, we had hoped to go to different regions of the state for our partner meetings. That didn't happen since they were all turned into Zoom. And then at the same time, we were gonna take the Navigator Night Outs regionally as well. So hopefully that will be something that we can work on in 2022. And really get out into different parts of the state and not just be so Metro Denver focused. And then we unfortunately lost 2 amazing advocates in 2020. So I know there's a lot of new faces at the table, but this is Vicki Toscher. She was a fierce breast cancer advocate. She's responsible for the coalition being on the voluntary contributions and getting donations every year when people pay their state taxes. She helped get that going. She helped with the breast cancer resource directory. She just always had patient at top of mind, and like, where's the patient in this? And then Dennis Ahnen, he was probably the greatest physician champion on the colorectal cancer task force. He was a GI, and he always just had great ideas to keep moving the coalition forward. So I want to stop here, and if you have a memory, of Vicki or have a memory of Dennis that you want to share, please either pipe in and share it or put it in the chat. But I just want to pause here and remember these 2 amazing advocates who have very much shaped who we are as a coalition.
I think the description of Vicki as fierce is really so true, because she was so passionate about everyone being accountable and present for the work that we're doing, that she raised the bar, I think, for all of us. And so I really appreciate her in that respect. So she really was a big heart of the Cancer Coalition for many years. And then Dennis, I just absolutely loved his gentle but thoughtful spirit, and thoughtful spirit as he contributed to all discussions related to seeing people with cancer as human beings, not as just another statistic. And that always impressed me as a physician and as also as a contributor to the spirit of our work.
Christy, I just wanted to say, Vicki was probably among the very first volunteer advocates I met when I came to work at ACS back in 2004. And there were just so many efforts we couldn't have won without her help over the years and her advocacy. And Dr. Anand, likewise, whether it was supporting researchers with ACS or helping us in our work on colorectal cancer screenings and colorectal cancer 45 screenings most recently. He was just always such a great presence and really such a catalyst for change. He spoke at our lobby day luncheon a couple of years ago with legislators, and really, I think, set things on fire for getting the colorectal 45 effort going, and they'll both be sorely missed.
Thank you both for sharing. Anybody else? I saw Carlin put in here. He asked if we included genetic testing results on cancer survivorship care plans. One of Dennis's nicknames was Rear Admiral, which is just so funny. But thank you all for taking a moment to reflect, and for everything we do, let's do it in their memory and make sure we can improve the lives of all Coloradans touched by cancer. So now I'm going to move on to 2021, which we have been busy again. So some highlights. Tomorrow, the cancer plan is launching, and we're going to be out in Cheyenne Wells. Allie and Andy are going to be out there representing the coalition. And we're launching this in, I'm going to go one slide forward. We're launching this in collaboration at the same time as the Communities That Care and from Cheyenne County, because it's, again, highlights a kind of, a local effort where our strategies are very much aligned. The Communities That Care has a lot of different strategies around prevention and capacity building and decreasing tobacco use and increasing healthy behaviors. And so it just really made a lot of sense to launch these plans together so that people could start to see, like, this isn't just like, these aren't just siloed plans. Like, the more we all work together, the better off all of our communities are going to be. So hopefully you will tune in tomorrow at 1 p.m. and you'll see all about the new cancer plan, how it aligns also with Communities That Care and their community action plans, and really just see like where we're going in terms of really getting out into rural and frontier communities and how we can hopefully move the needle in those communities. Here's another outreach we've done with the Colorado Academy of Family Physician, trying to get more physician champions to the table. It's really, our task forces are very successful when we can get physician buy-in and have physician champions that help move the work forward, help bring more physicians to the table. So be thinking about people you know and work with who would be good to plug into different task forces. Here's another outreach campaign that happened during, it was March, April, and May. And these ads led people directly to a map where they could then find a cancer screening location in Colorado. And these ads were all geared towards, it was Southeast Colorado. Well, it was kind of Colorado Springs and beyond and east. Yeah, Southeast Colorado, where we're trying to increase the screening rates and everything there. So hopefully as funds allow, we'll do kind of more of these targeted ad campaigns with different populations and really see if we can close the loop on getting them in for their cancer screenings. Here's another really cool collaboration. The Office of Community Outreach and Engagement from the University of Colorado Cancer Center helped get this map off the ground. We have had our directory on our site, but it's not a map, so you can't see things visually. So over here on the left-hand side, you can scroll down to different topics. And when you click on it, a bunch of dots pop up, and then you can find the resources that are in a community near you. Here's a few social media campaigns. And we had 28 people, I think, share their story for World Cancer Day. And we had about 16, 17 share their healthcare decision day story, or why they decided to create, fill out their advanced directives and other healthcare decision paperwork. And so again, just showing you here, this in the new cancer plan is 8.3, strategy 3, educate the public and medical communities regarding the differences between palliative and hospice and end-of-life care. So as I was posting all the stories on Healthcare Decisions Day, I was linking out to different resources in the community, as well as different resources online where people could learn about the different types of forms out there. Provider education and just general education is a lot of what the coalition does and the task forces do. So in January, we hosted a radon webinar, and then Allie and CDPHE hosted evidence-based intervention webinars around getting people back in for screenings, which again aligns directly with goals 5.1 and 5.2 to increase cancer screening rates. We launched a new campaign to really get people back in the door, get them back in for preventive screenings and preventive visits. And I wanted to highlight this partner update. The Ray of Hope Cancer Foundation started a new program to address mental health. And so now patients can go directly here, read all about different therapists and see who might fit to be their therapist, and then reach out to therapists. And it's for patients and their family members, so not just patients. And this really aligns with the goals around mental health for cancer survivors. Okay, let's go stop here for questions. And I know it's probably like drinking from a fire hose, especially if you're brand new, but I hope it gave you I hope it brought ideas, for how you can see yourself in the cancer plan, see yourself in the coalition, and hopefully it got you excited to keep moving this work forward. So questions before we move on to the next poll? Yeah, Janice.
So this particular one on mental health, does the coalition have a link to that on the website, or is it only at the Ray of Hope website?
We don't have a link to it yet on our website. We'll get it on that cancer resource map from the university, and I'll make sure it's in the agenda and see where it would make sense to put on the coalition's website.
Okay.
But if you go to Ray of Hope Cancer Foundation, it's very easy to find right now. Somebody might have even put it in the chat by now. Maybe.
Okay. Thank you.
Okay, somebody asked if they can get the slides. Yes, I will put the slides up onto our partner meeting webpage by tomorrow. Any other questions? Okay, so now I want to know, after seeing all of this, how do you plan to engage? So Becky, poll number 3, please.
It's already up.
Okay.
It's so weird, you can't see it.
Yeah, so the question is, do you plan to get involved in cancer plan implementation in the future? Or did you not even realize that the work you were doing was part of cancer plan implementation?
And again, if you don't like the responses, feel free to chat in a response.
We are at 88%. Let's see if we get a couple more responses before I close it.
I'm curious if the website that displays the cancer plan has a comment section where people can talk about through the year what they're doing to support any parts of the cancer plan. So we get to see the stories evolve in real time.
I love that idea.
Well, Christy, that sounds, I think, more like what we are planning to do to show who's doing what.
Yeah, so at some point in the near future, there will be a different map of who's doing what where. And so you could click on a goal and see who's working on that, and then reach out to them if they have information there. But our site is built on WordPress, so we might be able to have some sort of functionality where there could be a comment function where people could either ask questions or comment. So I think it's something for us the leadership team can explore that at the steering committee. So I'll jot that down, Janice, and we can bring it up in our strategic planning and at our next steering committee meeting.
Yes,
Yeah,
and I think it'd be great if organizations who see this and want to be able to share their story without somebody already reaching out to them would be a wonderful way to get people engaged and get to sort of, tout their progress on the site and contribute to the whole.
Yeah, Janice, I think that's kind of an ongoing conversation of how do we capture everything that's happening. And I think that's one reason that we are trying to get out of the Front Range too, because there's great things happening in rural and frontier communities that we just don't know about. So yeah, I think you're spot on, and that's definitely an ongoing conversation with how can we do that better.
Mm-hmm. And how they see their relationship to the whole.
Yeah.
Even though they may not know that it's contributing to the plan, now they can, and others can see that and emulate it perhaps.
Exactly. So we have 92% said yes. So that's exciting. The work will continue, Christy. And for anybody that said that they're unsure, certainly reach out to Christy, or we can figure out where your work fits into this. So we're just about to get started on the new plan. So I'm glad no one said no, because I was gonna call someone out and ask them why they were here. But yeah, all right. What's up next, Christy?
Okay. So continuing on what we talked a little bit about at the beginning, with this next 5-year plan and with the next action planning that the task forces will go through, we are definitely going to be using a health equity lens in all that we do and all that we prioritize, to make sure that we're doing the right things for Coloradans. So I just wanted to show we have done very little to start, but it is a start. We started hosting at our partner meetings, now I call them. We had intentional sessions on bias in healthcare, and we encouraged everyone to take the implicit associations test before they came so that they could reflect on their own biases, and then we could talk about it, how it plays out, and how we can mitigate that in the future. We hosted another session on LGBTQ+ issues. And then this past April, we had a session on microaggressions in healthcare. And it's just fascinating and sad about how often those microaggressions happen. But those recordings are, well, some of them are recorded, are on the website. Becky put the link into the chat. So this is a sampling of the trainings we've done. A few other ways we have prioritized this have been through our Cancer Fund grants. So really highlighting before people apply, like this is what we're prioritizing. And so we've done some motivational interviewing in rural parts of the state. HPV vaccination education sessions for Latino and immigrant populations, different skin cancer educations, like with the Mexican consulate, encouraging healthy behaviors in survivors and American Indian cancer survivors. So really intentionally finding partners that are reaching these populations and helping increase capacity and give them the funds to do their work. So as task forces are going forward and prioritizing what they want to work on, this is the type of thing we'll be looking at. Like, where does it align in the cancer plan? What populations is it reaching? And how can we make the biggest impact? Here's a few other things we're planning to do. We will be launching the cancer plan tomorrow, and then the steering committee will be going through a strategic planning process, and then task forces will be going through an action planning process. And then we'll also be expanding our leadership team to add a few more ad hoc steering committee positions from community organizations and other different populations to make the steering committee more robust and have more voices at the table. And we've had, membership in the coalition always ebbs and flows. And so I think we're also going to really look at, like, why are some of these organizations not at the table now? How can we get them back? And then also from you all learning, like, what are your training needs and how can we help meet those? So any questions on the approaches we plan to take, or thoughts on things we should be considering as we move forward?
I have a question about where we are with sort of the partner collaboration. I know there was initiation of a list of all the organizations that might share our priorities around cancer care and support, and that we were trying to build some collaborative alliances with them. Do you have an update on that, where we are with that?
Nope, I don't have an update. We have the list. We have ideas on who can reach out to different partners, and we just need to start reaching out to the partners. And so maybe between the different task forces, we can divide and conquer who's reaching out to which partner. And all of you, can just invite people to partner meetings, invite people to the symposium, invite people to your task forces. It is a priority of mine to focus on that, but it is just fallen as, like, launching the cancer plan and other things, just keeping it going. That piece has fallen. So I think I'm going to need to rely on task forces to help make those connections and bring people to the table.
Do we have some kind of digital media or video that we can share with these prospective partners to give them an overview of who we are and what we've accomplished?
We don't have a video, but we've got a page or two on the website that I think could be helpful to, like, refer to, that talk about who we are and how to get involved in the coalition or the task forces. Yeah, I'm open to other ideas, and maybe we can work with Catch It in Time to get a video created.
Okay, yeah, something that is comprehensive but not too long, so that we don't lose people's attention, but really promotes the progress and the efforts that we have made and where we are, especially with this new cancer plan, so they can review it and see if they can contribute to it.
Yeah, I think it's an excellent idea. And I have started in all the newsletters putting in a link where people can schedule time with me to learn about the coalition. And that I've had a handful of people do that. And then what I do is I connect them to the appropriate task force or to the appropriate committee. So that has been working. People have been seeing that link and wanting to learn more. So I'll continue putting that in there as well and having those conversations. Okay. All right, I'm going to turn it to Allie, since I've been talking for a long time, to talk about the next 5 years.
So we're going to do it all again. In 5 years, Christy is going to give us all drinking from a fire hose with more great things. So some of the things that we're really trying to prioritize that we've kind of already talked about just within our discussion is we want to get out of the Front Range. So we want to make sure that everybody across the state knows what about the coalition and what we're doing and how we can engage folks. So I'm leaving after this to go to Cheyenne Wells for the cancer plan launch, and I think that is really the beginning of our commitment to doing that and really reaching different communities across the state. Like we've already mentioned, really thinking about what our priority populations are with that health equity lens, making sure that we are engaging different organizations that have similar goals to us, and really aligning the work that we're doing. Fundraising, so we know that all this work can be done without resources. So thinking about different ways that we can add additional funds to what we're doing, including grants or working with different community partners or different pharma organizations or folks that have the resources. And then, like Christy mentioned, we really want to expand the steering committee to make sure that we are a comprehensive group that really can see everything from every perspective and make sure that the decisions we're making and the strategic plan for the coalition is in alignment with folks across the state from different perspectives. So a little bit more kind of about funding. So obviously all of this work isn't free, and Christy is only part-time and volunteers additional time beyond her part-time. So looking at kind of where our funding currently comes from. So we have the comprehensive cancer grant that Becky manages. So that supplies us with Christie's part-time, and also provides some funding for our cancer implementation grants. Voluntary contributions, we'll take your money if you would like to donate it to us. And that also includes on your taxes. So the cancer fund grant, which does give us a lot of funding to support our work. And then miscellaneous donations and grants. So we're kind of constantly applying for grants, and we definitely want to increase that. So we're working with an organization that can help us apply for grants and identify grants in the next year, which can hopefully add some additional resources for us. And then symposium supporters. So obviously the symposium isn't free for us to have and hold, but we do get generous sponsorship and the fees for attendees. So we add that too. But certainly if you see a grant that you think the coalition should apply for, or if you hear of any funding opportunities, certainly send those our way, because you know the more resources we have, the more resources we can give out, and the more of this great work that can continue. So a little more about the Cancer Fund. So this is the line 12 on your taxes. If you have seen all of Christy's persistent emails to remind everyone, but really exciting to see this continue to grow. So so far for 2021, we're at about $78,000, and historically this funding has went right back out in forms of grants for task force work. And so much of what Christy has just talked about to summarize the past 5 years has really been from this funding. So yeah, Christy, anything else you want to add to that?
Yeah, I think I'll just, so a rough number of you know, what the coalition uses in a year budget wise is around 125 to 175,000, and that's in putting on the symposium, staff time, and cancer fund grant, cancer plan implementation, basically, are the big ticket items. And so I just wanted to share that number because it's small and the cancer plan is very large. So again, it takes everybody thinking creatively, thinking outside the box, and bringing resources to the table to really make an impact in Colorado. So thank you again. And one day I hope I can get big sponsors for each chapter in the cancer plan. So a prevention sponsor, a screening sponsor, a survivorship sponsor, to then just really give task forces and partners really good funds to help implement cancer plan priorities. So think about, you know, grants we can apply for together, and opportunities that maybe you don't want to, you as an organization don't want to apply for, but would be good for a coalition to apply for. Please send those our way. Okay, so here's a sneak peek at the cancer plan. The goals will look very similar to the previous version. We did consolidate survivorship into one goal from 3 goals, and so it still has a lot of the same strategies. It's just more consolidated. So now we will have 9 goals with lots of different objectives and strategies within them. And so when you get these slides, any goal I referenced is a goal or objective from the new cancer plan, not the old one. So again, here's my plug. Join us tomorrow at 1 o'clock on Zoom as we're launching this new plan and really seeing it take shape in a rural community in Colorado as well. So that's this one. Becky, can you put the Coalition and Communities link in here? Because that has the link to register.
Christy Carlin has a question about our connection with the Cancer League of Colorado.
We have connected with them. I went to one of their partner meetings before COVID, and then we did apply for a grant from them for Survivor Day events, and we were not funded. So hopefully we'll just keep applying and find something that is up their alley, and they'll fund us for something in the future. So Becky just put the link in for the Coalition and Communities. If you scroll down on that page, you can find the register to watch link and learn more about Coalition and Communities. So again, just thank you all so much for being here. And together we can do so much for Coloradans. And I don't know if people know, but 23 Coloradans die a day from cancer, which is almost 1 person an hour, which is just an insane statistic when you look at it that way. And so all of this we're doing so that we can make that number less than 23 a day. So upcoming events, I mentioned the cancer plan launch. The task forces all either meet monthly or every other month. So if there's a task force you're interested in, reach out to the task force chair. The monthly peer sharing, we just had one yesterday on motivational interviewing. We have one next month on mental health and returning to preventive care. And then now that we're getting the cancer plan launched, you'll start to save the dates for the symposium at the end of towards the end of the year. So November 3rd will be all about lung cancer. And then November 4th will be our traditional symposium in person. That's what we're planning for right now with a remote option. And the theme of that is the time is now. The time is now to get back to screening. The time is now for genetic testing, genetic counseling. The time is now for clinical trials. The time is now to focus on survivorship. It's really like now's the time to just get back to all of it and make sure it's all top of mind. Okay, I know we ran a little bit over and I'm sorry, it cuts into the networking time. But I wanna, before we do breakouts, because inevitably people just disappear when we do Zoom breakouts, I wanna give you all a chance to share your partner updates. So if you have a new program, you have an event, you have an idea that you just wanna share, please feel free to pipe in now with your name, your organization, and what your update is.
I can go. I'm Laura Gabay, and I'm with Western States Cancer Research NCORP. So we're part of the 46 NCORPs across the country affiliated with the NCI. And our update is we're having our first in-person cancer patient outreach event on October 11th at noon. It's going to be in the same building as Rose Community Foundation. So we'll get you guys information about that so you can share. It's really open to everyone, caregivers, patients, anybody who find it interesting. And our topic is going to be cannabis and cancer. And one of our board members, Dr. Dave Gordon, is going to be the keynote speaker. So we'll keep you guys posted, and it includes a light lunch.
Great, thank you for sharing. Yeah, I'll add that. If you send me a link, I'll add it to the agenda so it can go out in the minutes.
I'm Sarah again, and I am with the University of Colorado and the Office of Community Outreach and Engagement, just in support of the cancer plan with the clinical trials effort and trying to increase clinical trials awareness. The Office of Community Outreach and Engagement is offering a educational program for people. Different community groups can sign up for it, individuals could sign up for it. It's really whatever you want it to be, but it's about a 30 to 45 minute educational session that we are doing virtually right now. I anticipate that we could probably do those in person in the future, but it's just a 30 to 45 minute clinical trials education session. It's general, it's not specific to any one trial or any one campus. It provides just a really nice kind of bird's eye overview of what a clinical trial is, how to find out about a clinical trial, what the myths are about clinical trials, and we try to address some of the common myths that we have. We do have a website for people to sign up for this clinical trials education session. I can put that in the chat as well. There is a sort of a research component to it in that we are assessing people if they would like to pre and post this educational session, just to understand how effective the educational content is. But again, it is general, it's generic, and I'm happy if there's clinical trials specifically or clinical trials finders specifically that you're aware of. I'm happy to connect you with that as well.
Great, thank you. And Sarah, I put the colorectal cancer study also in the agenda at the bottom.
Okay, yeah, I can add or I can talk about that a little bit more too. We have a colorectal cancer exercise study that I'm also a coordinator of. We're partnering, or it's a multi-site study with Colorado State University. So it's happening up at Fort Collins as well as the Aurora campus. We are doing a virtual exercise study essentially. There are some campus visits required, but it's only 3 and they're spread out over the course of a 9-month period. So we're excited about that change. It actually came as a result of COVID, but we think that it may be a change that's positive, just so that we can get more people to come in more people to join the study. But the study is open for people who have finished colorectal cancer treatment within the last 5 years. And we actually also have a webpage for that as well. So I'll put both of those in the chat too.
If it's okay, I could pop on now. This is my first time here. But I work with I'm Ryan Marker. I'm at the University of Colorado at the Aurora campus, and I work with the cancer exercise program that's helping out with that colorectal cancer study. So we're also expanding our, so we're continuing to operate in person, but also trying to expand our virtual offerings. And I believe there's already a link in the agenda for our program, which includes information on our in-person and our virtual program. And then specifically, I have a study looking at the virtual exercise program for rural cancer survivors that I'm trying to recruit individuals for. And so there's a link for that in the agenda as well. And that's for individuals, breast, prostate, and lung cancer survivors who are within 1 year of having completed their treatment, and it specifically targets cancer-related fatigue.
Hi, my name is Janice Hansen, and I am an oncology social worker with the Steps Through OC program that Clarity Foundation offers nationally as a free support program for women with ovarian cancer and their family caregivers. And September is Ovarian Cancer Awareness Month. And I just wanted to let you all know that if you know a woman who is living with ovarian cancer and has an amazing story to tell about her experience, that she can be nominated for this national recognition as a teal woman. Teal is the color for ovarian cancer. And I'll post that link for the nomination in the chat. Those nominations are due by September 1st. So we hope that you will keep in mind any woman that you know who is living with ovarian cancer, both for the free support program as well as the nomination for a Teal Woman recognition. Thank you.
Hi, everybody. I'm Carol Hayscamp, and I am the Pfizer Oncology rep in the area. But I'm actually going to talk to you a little bit about another organization I participate with, which is the Healthcare Business Women's Association. And a subgroup of that is the Women in Healthcare Giving Back program. We actually are charged with trying to find donations for needy third world countries for medical supplies and equipment. If anybody is interested in that information and wants to reach out to me, I can give you more specifics, but we're definitely looking for more organizations that might be willing to participate in donation process as well as volunteering with us. So thank you.
Thank you all for sharing. As I was looking back on things we have done, at one of our partner meetings, we hosted a cereal drive for Project Angel Heart. So Carol, definitely send me that info, and I'll include the link in some of our newsletters and get the word out there. And Janice, thank you for sharing about the nominations. I'll get that out too. Any other updates?
Christy, I have something to share just from an email that I had received asking for some outreach. There's a free retreat for women with breast cancer in the Western Slope. I'm going to post the information in the chat, but hoping that folks on here can help spread the word if you know anyone. The deadline to apply is tomorrow. I don't know if they'll extend it, but there's information here. It's from a national organization called Casting for Recovery. So if you know anyone who might be interested, feel free to pass that on.